Hi, my name is Sanam Khatri, and on this project 2 for this class, I'll be talking about the lolamycin, a microbiome spreading antibiotic. It is a new narrow spectrum antibiotic that shows lots of promise for treating multi-drug resistant gram-negative infections without damaging the gut microbiome. So in these presentations, I'll be talking about the problems with current antibiotics, how lolamycin works, and what its advantages are for clinic use. So let's just start by looking at the current disease problem, and why new antibiotic like this is even needed. So right now, multi-drug resistance gram-negative infections are rising, especially in a hospital, right? So this infection can be severe and sometimes even life-threatening, like there are a high mortality rate in the hospital, and unfortunately many of our existing antibiotics aren't effective anymore because like bacteria are being more resistant to the antibiotics. So hospital are also running out of the options. So to understand why this is such a big issue, we have to look at the limitations of the antibiotic we have. So looking at the problem with the current antibiotic is that most antibiotic used today are broad spectrum, meaning that they kill both harmful bacteria and healthy bacteria in our gut. So, which leads to something called dysbiosis, which is basically an imbalance in the microbiome. So, when that happens, patients become more vulnerable to the infections called difficile, which can cause more severe diarrhea. And because broad spectrum antibiotic hit many types of bacteria at once, they also contribute to the spread of antibiotic resistance. So this is really where antibiotic like lolamycin comes in, and it was developed to solve exactly this kinds of problems. So what is lolamycin? So lolamycin is a narrow spectrum antibiotic. So, and instead of killing everything, it specifically target harmful gram-negative pathogens such as drug resistance E. coli. And the key difference is that it is spreads beneficial gut bacteria, and that's what really it sets apart from the most antibiotic we currently use. So let's look at the mechanism of lolamycin. And lolamycin works by blocking the LPTD pathway, which bacteria needs to transport LPS to their outer membrane. And without this transport, the outer membrane became unstable, and bacteria eventually die. Right. So what's important is that many helpful gut bacteria do not rely on the same pathway. So lolamycin doesn't harm them, and dolamycin doesn't harm them. And also the researchers have already tested this in animal studies. So let's look at on that one. In so For this one, they have already started like the research on the mouse study, and in the mouse study, lolamycin was lolamycin has successfully cleared serious gram-negative infections. But what's even more impressive is that it preserved the natural microbiome. So mic treatment with lolamycin has a much lower risk of developing C. difficile like symptoms compared to the mice treatment with regular antibiotic, and like which is like truly a big advantage. So based on this research, there are several clear benefit that lolamycin can offer. And looking at the advantage over our current antibiotic is that lolamycin only targets certain pathogens, and it reduces unwanted side effects like gut bad disturbance, and it also creates less pressure for bacteria to develop resistance, since it isn't wiping like out large population of microbe at all. So I think it is like a very more effective than the one that we have currently. And overall this makes it more safer and more precise options. And saying that, we also have to look at potential clinic impact. And In a hospital setting where multi-drug resistance infections are common, lolamycin could become a valuable treatment tool. Since it protect the microbiome, it may also help decrease hospital acquired C. difficile cases, right? And because it is a narrow spectrum, it fits well into antibiotic program that aims to use antibiotic more responsibly. And saying that, we also have to keep in mind that there are limitations to that, and also because lolamycin is still in the preclinical stage, meaning that it hasn't been tested in human yet. And researchers are still are also in the study for its safety, the correct dose, and many potential side effects that it's going to cause to human, right? If it's going to have any side effect on the human body or no. So there can also be like challenging in manufacturing it in a large scale, but with all the consideration, I think the takeaway of this antibiotic is that lolamycin is a promising new antibiotic that especially target dangerous gram-negative bacteria while protecting the gut microbiome. And if human clinic trial confirm what animals study shows, then I think lolamycin could become a much safer and more effective options for treating multi-drug resistance infection in the hospital. And finally, these are all the reference that I have used for my research for this project. And thank you. Have a good one.